In recent years, the dairy beef feeder calf project throughout Ohio has gained interest and shown tremendous growth. During the same time, the cost of participating in the dairy beef feeder calf project has grown significantly. On February 19, 2025, Ohio State University Extension hosted a webinar via Zoom and took a detailed look into the economics of the dairy beef feeder project in 2025, strategies for keeping calves healthy, and providing proper nutrition for the dairy beef feeder from birth until the conclusion of the project. Listen in as OSU Extension Beef Field Specialist Garth Ruff introduces the evening's program, Dairy Beef Feeder 101.
And welcome to the 2025 Dairy Beef Feeder Project webinar. I'm Garth Ruff, Beef Cattle Field Specialist for OSU Extension, and I'll let our other speakers introduce themselves as they go. Kind of what we're going to cover here this evening, alluded to it a little bit of the economics of the Dairy Beef Feeder Project as we go in to county fair season. Dr. Kiefer's going to talk about how we keep calves healthy, and then Jason's going to talk about proper calf nutrition as we go throughout the project. As we think about the cost of the dairy beef feeder project, I showed these back in the mid and early 2000s, where the Holstein bull calf at that point in time, was somewhere between $100 and $150, maybe up to $200 for the top of the line one. Where we really started to see some change in the supply of these animals, starts with sex semen in the dairy business. Some of those first sex semen generated heifers hit the market in 2007. And it really comes down to how many heifers do we need in the dairy industry? That's a question that Jason can articulate a lot better than I can. But there's a finite number of dairy replacement females that are needed in order, not only to maintain the value of those females, but to maintain the price of milk as well as they go into production. Probably the biggest thing that we've seen have an impact on Holstein bull calf prices here recently is using beef semen to breed dairy cows, or what we call beef on dairy, often in combination with sex dairy semen. There's an opportunity here for the dairy producer. If you kind of look at the chart on this slide, as a dairyman, maybe the strategy is to breed our high-performing dairy cows to sex semen in order to get heifers out of those cows and put back into the milking herd. And then traditionally, we would follow that up with conventional semen use. But here in the last 3 to 4 years, what we've really seen is the opportunity to add value to male calves and add value to calves from lower performing dairy cows by using beef semen, maybe on that bottom 50% of the milking herd, add value to those offspring. Those cows, we may or may not want their heifers to enter the milking population just based on past performance and genetics. So as we look at some of the data, we start seeing beef on dairy, or the use of beef semen in dairy cows, start to really creep up in 2018 through 2019 and continue to increase today. Some research done out of Penn State shows that about 75% of dairy farms in the Northeast, Pennsylvania and East, are already currently using beef semen. There's another 5 to 6% looking to use beef semen in the future. And only a small percent of dairy farms captured in this survey, less than 20%, are not using beef semen and have no plans to in the future. So couple that we got a lower supply of dairy bull calves to begin with because of advances in genetics and reproductive technology, and then the switch to beef on dairy. But as we look at the beef side of things and our cattle inventory from one year to the next, continues to decrease. It's continued to decrease since 2019. And on the beef side of things, we're currently operating with the smallest cow herd since 1961. So not only do we have a reduced supply of dairy bull calves, we've also got a tighter beef supply from our beef breeds as well. And that tighter beef supply has led to a pretty drastic increase in fed cattle or fed beef price, with the start of 2025 setting all-time record highs where we're selling fed cattle, on average across the country over $2 a pound. So it's that combination of everything that has led to this increased price that we've seen in dairy bull calves. I pulled the Mount Hope auction report there from last week. You can see the back to the farm Holstein bull calves. The top 50 of those Holstein calves average almost $720 a head. Certainly there's range there up to $850 and as low as $535. We talk about that beef on dairy and the advantage economically. You can see those crossbred beef on dairy bulls. The top 40 of those average almost $950. Crossbred beef on dairy heifers, also some value. The beef on dairy calves anywhere from $750 to $1,200 a head. Keep in mind these calves are less than a week old in most cases. So certainly an increased value in those animals and an increased cost as we look at the dairy beef feeder project going into 2025. So with that, I'm going to turn it over to Dr. Kiefer, talk about calf health.
All right, thanks, Garth. See if I can get my screen shared here. Can't enable my video. I think you got that, but I'll share my screen.
You should be able to share.
Right.
Try it now.
You see that? You put it in presenter mode. Is that in the right order?
Yep.
All right. Let me go back here. So thanks, Garth, for the start to the meeting. Just to introduce myself, Justin Kiefer. I'm a clinical veterinarian and associate professor in the Department of Animal Sciences and Office of the Attending Vet in the Ohio State University. I'm based out of Columbus on the main campus, and my job, for the most part, is to provide clinical vet care to all of our teaching researchers around the state. That includes our dairy farms, equine, beef, swine, poultry, you name it. I provide the care for that. I also teach an undergraduate animal health course. I'm a research collaborator across a bunch of different subjects in animal sciences and the College of Veterinary Medicine, including euthanasia, animal health, nutrition, physiology, and things like that. So that's my basic role at Ohio State, and Extension asked me from time to time to come speak about topics, and so I'm happy to come do that. After I graduated from Ohio State's veterinary school in 2008, I was in private dairy practice in Southeast Michigan, Northwest Ohio for 6.5 years. So that's my background is dairy. So pretty familiar with working with young dairy calves. And Jason asked me to just come up with some topics on respiratory disease and also calf diarrhea in terms of definitions and how to diagnose and treatments and prevention. So I threw some of those together for you today. Today, we're going to talk about a basic physical exam, and all of you should learn how to do this if you're going to raise dairy calves, or maybe you already have if you have raised them in the past. Just getting into a system of working around an animal to figure out what their basic physical status is a good idea, and I could train any one of you to do that. I'm going to teach you about the basic clinical signs of pneumonia, what are the treatment options are, and how we can best prevent that. That's a pretty devastating disease in calves. And clinical signs of diarrhea, what those look like in calves, how we define that, what are the treatment options depending on the severity, and again, how we prevent that as well, because that's going to be the best medicine is prevention. So when I'm working around animals and I'm also training farm staff, which I did in private practice and I do now for university, I really try to emphasize, what is normal versus abnormal when we look at a calf or a cow or a foal or a horse or a pig. And it's really easy to set some basic guidelines of what we're looking at in a basic physical exam that any one of you can do. You don't need to have a DVM to do that. So what are we looking for a calf in terms of physical exam on intake? We're going to look for normal temperature, 101 102.5 is about average. If it's hot outside and they've got a really dark coat, I could give up to 100, 103.5 in terms of upper boundaries for body temperature. So that's what I'm kind of looking for normal temp. All of you, if you're going to raise calves, should have a thermometer with you. You can buy one at CVS or buy a bunch of cheap ones at CVS. They work really well for taking quick temps on calves that you might think are sick. Respiratory rates tend to be a little bit higher than adult cows. They tend to be 30 to 40 breaths per minute. Again, they're going to pant a little more in warmer weather. They can't sweat, so that's how they blow off some of their heat. Their heart rates tend to be higher than adult cows, anywhere from 100 to 120, so even more than that. We want our calves to be BAR, bright, alert, and responsive. So their eyes are fully lit, their ears are up, following you around, watching you, running away from you, alert, reactive to you. That's the proper attitude of a calf I want to see, not a calf that has its ears down, it's depressed, not reacting to me as I'm trying to move it around to the pen. So I want to see that BIR calf. And a manure. Looking at manure can tell you a whole lot about an animal's health status, no matter what the species is. And cows and calves are no different. In cows, we typically expect to have a solid to pasty appearance in the manure, depending on their diet. Especially calves on milk tend to be a little softer, more yellow or whitish in color. But again, that's what we expect a normal calf to look like in terms of these basic clinical signs. And you can have these written down in your notebook, in a treatment log, in a treatment protocol from your veterinarian as to here's what I expect a normal calf to be on intake or when I'm examining them. And if it's outside these bounds, what should we do? We should establish some treatment protocols for that, and we'll talk about that. So the first topic I'm going to talk about is respiratory disease in calves. It's the second biggest killer behind diarrhea, which we'll talk about next in young beef and dairy calves. Typically, it's defined by having a fever, so that's over 103.5 Fahrenheit. Sometimes they're 104, 105, even up to 108 I've seen in calves with pneumonia. So pretty significant fevers. Respiratory rates are typically increased, and there's some physiologic reasons as to why that's increased. A lot of that has to do with their lung anatomy. Also, it's undergoing some damage from the pneumonia process, so their respiratory rates are going to jump up. It could even double from normal. Heart rates tend to go up as well. Due to the painful responses, the stress of being sick will drive heart rates up higher into 130, 140 beats per minute. You're going to see a lot of increased respiratory effort. You're going to see these calves push in and out with some abdominal effort, which you typically don't see a lot of in cows. And if you put a stethoscope on their lungs, and for those of you that are interested, you can learn how to listen to lung sounds in cattle. It's really not hard to do. Listening just behind the elbow and up above that space, closer to the top of the spine and on down, just behind that area. Put your stethoscope on there. You should hear some really light breath sounds, and that's the classic normal lung sound for a cow. But if you put it on there and you don't hear any lungs at all, or if you hear a bunch of crackles, wheezes, or wet lung sounds, then we're going to typically suspect that we have pneumonia. Some calves will have a nasal discharge, like this beef calf does at the top upper right-hand part of the screen, and that can be a varying different colors. It could be a clear discharge. I saw a lot of actually mature cows this year with on a dairy that had highly pathogenic avian influenza with a ton of clear nasal discharge. And you can see that in other normal viral cases that cause pneumonia in calves and cows to varying degrees, all the way up to thick, snotty, white pus. You also see some eye discharge too. A lot of the agents that cause infections in the lungs typically cause some conjunctivitis of varying degrees. So you see some drainage from the corner of the eye, some crusty eyes, typically with pneumonia signs. They're going to be off feed. They're going to be anorexic. They're not going to want to eat. They may have a stiff gait. Typically, the chest is pretty painful when you try to palpate them. And they're typically more reluctant to move, especially in cases of severe pneumonia. These are the calves that are going to hang back away from the feed bunk or away from the milk bucket when you deliver that and not be too interested in eating. So what's the impact of respiratory disease in calves? Well, the problem with cattle in pneumonia is that they have a vastly diminished lung capacity in terms of their body weight compared to, like, say, a similar sized horse. It's about 30% of this size of horse. So if you take let's say 1,000-pound calf and 1,000-pound standard bred mare, a mare has a lung field that's 70% bigger, okay, than the calf, which is kind of alarming if we have a large animal like a calf with a really large body and a really high metabolism like our Holsteins do that we're talking about today, and our beef cattle. They're bred to be metabolic machines, and they need a lot of oxygen. Cattle have about 250% greater oxygen demand than a horse. So they have, number one, smaller lungs and a huge oxygen demand. So those two things set them up for a lot of issues when they get pneumonia. Their lungs are highly lobulated. And that picture on the lower right-hand side shows some punctured area of the lung where it's kind of pinched in. That's an area of scarring for pneumonia, and that can get really extensive. I'll show you some pictures later of that. When those areas are damaged, those walled off sections don't recover. We also get really strong inflammatory responses in the lungs of calves during pneumonia. We'll get a huge influx of a white blood cell called neutrophils and some other white blood cells. And when they come in, it's typically of cattle, and I don't understand completely why, but they have high numbers of these white blood cells that come in and cause a tremendous amount of damage. And it's that secondary inflammatory response that really drives down recovery of the lung later on. So that's why typically, for those of you that have experience in the beef or dairy industry, when you treat a calf or a cow for pneumonia, they typically don't do very well in terms of rate of gain, milking, performance, things like that down the road. And these are the physiologic reasons why. So causes of respiratory disease calf or underlying issues. We're going to talk about nutrition with Jason here in a little bit, but inadequate colostrum intake. That is really important in the dairy world. Our heifers on our dairy operations are a priority. They're going to get colostrum first. For our bull calves, they are typically less important, and it's a kind of a crapshoot. Sometimes if you're buying bull calves out of a sale barn or an unknown place, whether they actually got colostrum. So if you're going to buy them, I'd strongly encourage you to actually require colostrum to be given to those calves or document that via doing total proteins after those calves have left, doing some testing, things like that. Because if the calves don't get colostrum, they don't have that IgG on board to protect them in the first 3 to 4 months of life. That is a setup for respiratory disease. They don't have protection. Number two, they don't have much of a functional immune system. So outside of not having IgG when they're born, their ability to make antibodies on their own and make cytotoxic T cells and other important white blood cells for their immune system to communicate and function takes a lot of time. There's a lot going on in a young calf, lots of growth going on in development, and the immune system is part of that as well. And it can't really respond to, number one, diseases like pneumonia very well. Also, number two, to parenteral vaccines like injectable ones we'll talk about in a little bit. So that naive immune system really sets them up for respiratory disease too. Poor nutrition. We underfeed dairy calves. This is the only neonate in the agricultural world that we limit feed, if you think about it. We don't limit feed piglets because they're on mom. We don't do that to foals. We don't do that to lambs, to kids. Or to beef calves because they take whatever drinks they want. So these are calves that we're typically underfeeding. They're not really feeding to what their natural performance could be. And I'm sure Jason's going to cover some of those programs now where we're trying to push more volume and nutrition in these calves. So if you starve the immune system, it won't work well. Poor ventilation is also a major issue in dairy calves. We don't have barns that are set up for proper airflow. We want 4 to 5 air changes an hour. We want nice, clean, cool air coming down on them, and proper bedding to prevent ammonia buildup, and proper cleaning as well. So ventilation is key. Commingling with new cohorts. So we bring in calves from different farms together that don't know each other. They have new bugs, different strains of viruses and bacteria that they come with. That leads to certainly large numbers of outbreaks and also stress when those animals set their new pecking order, because they're going to do that when they get into new pens and figure out who's going to eat first and who's going to eat last. Weather challenges. Right now it's 20 degrees out and fairly dry, and this is actually fairly good weather for calves in my opinion. But when it gets wet and it gets windy and we get wild changes from 20 degrees, let's say up to 60 and vice versa, that can be pretty challenging for calf health. And then transportation stress is big too. We move cattle hundreds of thousands of miles across this country every day, sometimes for 14 to 20 hours at a time. Sometimes you can buy bull calves that have been trucked from the East Coast to Ohio that have been on the truck for 8 to 10 hours. That is very stressful on an animal. They typically stand up. They don't get any drink, any drinks, or they don't get any milk in the case of these young calves. So that stress can be a big impact on animal health, especially for pneumonia. So inadequate colostrum intake, very common to see in dairy bull calves. This is basically the passing of the first milk or colostrum to the calf from the cow. It's full of IgG antibodies. Really uncommon to see failure of passive transfer of colostrum in beef calves. That's mom's job. If she doesn't do that, typically she's fired. But in the dairy business, we do that. It's important for the dairy producer to do that, or if you're a calf buyer, make sure your calves you're buying do get colostrum. It's not a death sentence if they don't get colostrum, but it will set them up for higher risk of disease and also death. So I would just say if you're buying calves with an unknown colostrum intake from a farm, that's fairly risky, and you don't know exactly what's going to happen there with that particular calf. Why is that colostrum intake so important? They don't get maternal antibodies across the uterine lining in the placenta. So there's a separation of fetal and maternal blood supply. So calf is separated from mom, and that's species dependent. So humans, we have some of that. Pigs have some of that. Cattle, horses, sheep, and goats do not. So that calf, that foal, that goat kid, that lamb, need IgG to be delivered to them via a meal right after they're born to cross those cells in their GI tract and go into the bloodstream. So they need that IgG. That ability to absorb that IgG rapidly declines after 12 hours and is pretty much gone after 24 hours. So what's the typical recommendation for like a modern 60 to 80 pound Holstein calf is to get a gallon of colostrum into them by 6 hours of age. That's typical recommendation I have for dairy farms, is to get them that much colostrum. That's a little over what you typically need, but we want to err on the side of giving more, especially if that colostrum is a little dilute, to get enough IgG in that calf's bloodstream. And that's going to protect them for the next 3 to 4 months. In terms of the causes, we call this the bovine respiratory disease complex, and this is how I teach my undergrads as well. It's a multifactorial problem. We get lots of stress from weaning, which is the most stressful event in any mammal's life, up to that point in time. Environmental stress from weather issues, travel. I mentioned transportation stress, social interactions, rough handling. Those are major, and those build up, and that leads to a really high level of what's called cortisol, as a stress hormone. The stress hormone is directly a down regulator of the immune system. It reduces the amount of white blood cells present in the calf. It reduces the activity of those white blood cells, and it limits their ability to talk to each other and help provide defense. So those stressful events have a major impact on that calf. Again, we talked about failure of passive transfer immunity, really a big issue in dairy calves and sets them up for respiratory disease. We have a host of viral infections. I got my cartoon here that I have in my slides for my students as well. These viral infections, IBR, parainfluenza virus, that's PI3, BVD, and BRSV, those agents are typically the setup for secondary bacterial infections that come in later. And those typical bacterial infections are bacteria that are already present in the lungs and not causing any problem at all. They're normal, commensal organisms that live there, but in times of stress and also times of infections from viral agents that set up the damage to the lungs, they can start to take hold and cause problems. Again, agents that we typically worry about for the most part, respiratory disease. I'm not going to go into super high detail in each one of these, but these are the ones that we're really worried about in terms of protecting our calves for, and the ones that we see most often. Viral, that's infectious bovine rhinotracheitis. There's a calf in the top corner of this slide set where this person is sticking their finger on the back of this calf. BRSV signs typically come with high fever, coughing, hypersalivation, but the most common thing we see with with bovine respiratory syncytial virus is emphysema, and that's air that happens underneath the skin. It's kind of a air bubble or a bubble wrap you can feel underneath the skin. Very common to see with BRSV. Infectious bovine rhinotracheitis, that's the middle picture here. That is a cross-section of a trachea. I know it's a gross picture and it's around dinner time, so I didn't want to gross you guys out too much, but this is what happens in rhinotracheitis. It is a inflammation of the nasal tract, which is the old name for this disease, which is called red nose, where you see swelling and erosions on the nose and on the face of those animals. But you also see it in the trachea, and that's what happens here. They get a big, really irritating infection from the virus inside the trachea, and the lining of the trachea basically sheds and clogs it up, and some of those animals actually suffocate from it. We also have parainfluenza virus, which is more of a minor player in terms of viruses for respiratory disease. It's found commonly in co-infections with BRSV and IBR, but it typically sets up a lot of secondary bacterial infections. And then we have BVD, and this is a virus that causes diarrhea, which is, of course, in the name. But BVD is also a major immune suppressor in calves. It drives huge numbers of white blood cells down into the low digits in animals, and it's a big immune suppressor that feedlot operators look for. They look for calves that are persistently infected with BVD to eliminate from the herd, because BVD, if it's floating around, will be a big immune suppressor for calves on intake and feedlots, also on dairies. It has major reproductive effects. So it's basically a huge setup for respiratory disease and really large operations. So we're hunting for BVD, persistently infected calves all the time. Bacterial, these are the secondary agents that typically we find in the upper respiratory tract, in the lining of the trachea, the bronchi, back of the throat. And they're always there, but they may grow and bloom and cause significant pneumonia and disease signs after those viruses have caused the initial infection. And those are Mannheimia, Pasteurella, Haemophilus, and also Mycoplasma bovis. This picture on the lower right-hand side is a calf with bronchopneumonia from Pasteurella. The lung here on the top of the lung is somewhat light and pink and fluffy, what you'd like to see on a normal lung. And this lung in the caudal, or the ventral part of this lung, the area closer to the bottom of the chest, and the sternum is really heavy and wet. It looks like liver. It's nice and dark. It's got some white spots, which are fibrin, which is part of the inflammatory response for pneumonia. That's a typical sign of classic bacterial pneumonia on a postmortem exam. So the key point here is that a lot of these viral infections create the damage, and then the secondary bacterial infections come in and cause even more. So what can we do for treatment? So let's say we have an outbreak or a single calf with pneumonia. We're going to typically use antibiotics. They're not going to do anything for the viral infections. There's no approved antiviral drugs, at least for now, for livestock. So we're typically going to use these to help treat those secondary bacterial infections. So examples are up here of tulathromycin, astraxin, Encrexia, macrocin, Nufor, enrofloxacin. There's many of those labeled for pneumonia in beef and dairy calves that are effective. You should work with your veterinarian to develop a treatment protocol for those various bacterial agents that I just mentioned, and which one would work best for your herd or your particular animal to use in case you see pneumonia. What's the data say for the use of NSAIDs, so non-steroidal anti-inflammatories in pneumonia? In the research space, not a whole lot of support for use in cattle. From a clinical perspective, I like to use NSAIDs like flunixin, especially verbanamine, which is the trade name. For fever reduction, they are labeled for that, and they do a really good job of reducing fever. Do they reduce a lot of the signs or damage of the lung? Not so much. Do they bring calves up into a higher rate of gain after your treatment? Not so much, but they are beneficial in making that calf, I think, feel better and reducing the fever, trying to get them back on feed quicker. So I do think they're beneficial. Meloxicam is another drug we use frequently in livestock, especially cows, for pain control. It's much better for musculoskeletal pain, let's say for lameness is what I'm talking about, less so for fever reduction. So Banamine tends to be a better choice there. And all of these drugs that I'm talking about require a prescription. We'll talk about some of the expectations around that at the end of the slide set here. The biggest thing about pneumonia is we want to prevent it. And if we're buying calves that we're going to raise for 4-H projects or feed out, we want to buy calves that have received colostrum. That can be as simple as a contract you write if you're buying especially large groups of calves, saying, hey, I'm going to buy X number of calves this month. I expect them to get colostrum. I'm going to pull blood samples from those calves when they arrive on my farm and spin them down and see if they have enough total proteins. And that's going to tell me if they got colostrum. If they don't, then maybe we reduce the price or I don't pay for them. So highly encourage you to work in arrangements when buying calves to make sure they get colostrum. Keep calves on a high plane of nutrition. Starving calves will make them sick, and Jason's going to go over that here in a little bit. But we don't feed dairy calves enough, and we figured out that, hey, if we actually feed them on a higher plane of nutrition, or actually what they'd more naturally intake from when they're left on a cow, they don't get sick as much. They do really well. We know from the heifer development standpoint in dairy calves, if we feed a heifer higher volumes of milk during that 60 days when she's on milk, and then we wean her off, a year later, when she's in the lactating herd, she's going to bring us about 1,800 pounds in that first lactation of more milk because she was fed more as a calf. She didn't have disease events that set her back. So we know it has huge effects on the performance of that animal down the line, not just during that milk feeding phase. Manage weaning stress. I think Jason's going to talk about that too, how to ease calves that are on higher planes of nutrition and high volumes of milk onto solid feed, because eventually they're going to have to be a ruminant. They're going to have to figure out how to eat solid feed, grains, silage, forages, grasses, things like that. And so got to try to ease them onto it if we're feeding really high volumes of milk every day. What I also like to do for calves that are freshly arrived onto a farm, whether you know the vaccine history or not, is to give them an intranasal vaccine. Those are safe and effective. It can be given to any age animal for that matter, but really great and provide protection right in the nose for up to 90 days for several of the products that are out there. And also consider giving another dose at weaning time, which also is going to be a real stressful time where you may start to commingle your calves. Again, a good idea to protect them in that window. Making sure where you're housing your calves has proper ventilation. If you walk into that barn or shed, wherever you're housing them, and you smell ammonia immediately, the air quality is already bad. You don't need to go into an advanced study or wind study of your barn to just figure out that the airflow is bad. If you're a larger producer and want to know if your ventilation is good, there are lots of qualified veterinarians around the state. I'm friends with a bunch of them who actually do these ventilation studies in dairy barns, specifically for dairy calves. They do a great job. They can provide great pointers on how to improve the ventilation. And also, if you're bringing larger groups of calves, try not to have a constant inflow and outflow of calves on milk, especially in group pens. You want to try to separate them by age as close as you can because they will have a pecking order. Older calves can have different disease stresses versus younger calves. So mixing calves of significant different ages is not really a good idea. Here's the vaccines I was talking about. I'm not acting as an advertisement for any of those, but these intranasal vaccines are really protective. I use them in private practice. I use them on my university animals. They're excellent. They can be given as soon as that calf hits the ground while it's still wet. And it's safe for any age animal for any type of adverse reactions. Generally not any issues with those. And they provide, again, about 3 months of protection. One thing we worry about when giving those parenteral vaccines, which are on the lower right-hand side of the screen, these modified lives like Express and Bovie Shield, which are excellent vaccines, but we give that to a young calf that has gotten colostrum. That colostrum is going to have antibodies in it that will interfere with these parenteral vaccines. So I tend not to recommend giving these injectable vaccines on the lower right-hand side till that calf's 3 to 4 to 5 months of old, till those maternal antibodies have started to wane and go away, and they won't interfere with that vaccine. Also, some of these modified lives, if you're using those, have modified live BVD virus in it. And while that virus is attenuated, it's not going to cause major issues. It can still immune suppress a calf, which is really what I do not want to do to a calf that's 1 to 3 months of age. So we want to avoid giving those until we're getting closer to weaning time for beef cattle, or we're taking the calf into multiple group pens as a dairy calf. So that's my spiel on vaccines for respiratory disease. Again, intranasal is really good for these young calves that are on milk, in my opinion. So shifting gears a little bit to the second part of my talk, diarrhea in calves. This is the biggest killer by far and away of dairy and beef calves. Again, lack of colostrum intake, huge risk factor in terms of the percentage of calves are going to get sick and die on the farm. A higher percentage of those are going to happen with calves with low or zero colostrum intake. Poor feeding practices also increase the risk. We do a lot of stuff that's really harmful to these calves. We don't feed enough milk. The old 8 to 10 to 12 ounces of milk replacer twice a day to a modern Holstein calf is basically a starvation diet. And that's typically how we fed a lot of the calves over the years, especially when I was a younger kid showing feeder calves. We needed to feed them more milk. And we've taken a long time to figure out, hey, if you feed them more, they grow better and they don't get sick. Another issue, and I'm sure Jason's going to get into this too, is mixing milk replacer if you're using that improperly. It needs to be mixed according to label directions, and don't vary from that too much, especially on the day in, day out basis. Don't add too much powder or take away too much water if you're trying to change that within a 24 to 48 hour period. If you're going to make changes when you're feeding calves, do those gently, but I'll let Jason get into that. And then dirty equipment, dirty nipples, bottles, buckets, calf feeding areas that aren't cleaned properly. Milk is pretty gross if it sits around for a long time. You all know that. It is gross on this calf equipment as well. Once it's done, we need to take all this equipment away, like these calves that are on the bottle in this barn. Take the bottles out, take them apart, scrub them, clean them, sanitize, hang them to dry before we start the next feeding cycle. What is diarrhea look in calves? Well, it might seem obvious, but we want to throw some definitions out there. Typically, the manure is soft to runny, even to pipe stream diarrhea. I have a calf here with a wet butt on the right-hand side of the slide set. Has some yellowish staining on its rear end. This looks like a relatively fresh or recent case of diarrhea that started in a calf. And that diarrhea can be white, can be dark yellow, can be dark reddish with blood tinges in it. So it can have a quite variable appearance to it. You might also see some mucus, some chunky, snotty kind of looking stuff, especially in cases of calves with salmonella. You may have fever, obviously depression, dehydration. Dehydration is the big killer of calves with diarrhea, which I'll talk about extensively here. They're typically going to be less interested or not interested in drinking their milk at all. They may not be able to get up, or if they do, they may need assistance to have you pick them up and walk them around the pen. So that's the typical clinical signs we're going to see with diarrhea in calves. What does normal manure look like? On the right-hand side, we have this calf up in a cage. That's a typical manure I like to see on a calf and milk. Nice pasty, but still fairly solid manure that forms piles. In the middle, we have a calf with scours, pipe stream diarrhea. On the left-hand side, that is a picture of a calf with bloody diarrhea, and that's the blood tinge you see in the center of that pile. And there's lots of variations in between. So that's kind of the stages of manure. You can actually grade these out. I'll show you a picture from the Wisconsin scoring system where they kind of grade out what the calf manure should look like in a healthy versus disease state. One of the things I want to point out is that don't just look at the manure. There are some people that worry about calves getting nutritional scours or actually have diarrhea. So calves with diarrhea that are ill from a diarrhea agent, we'll talk about those, what those might be, the viruses, the protozoa, even the bacteria that cause that. The calves that have nutritional scours look much better. They're bright and alert. They want to eat. They just have a little bit of loose manure and wet butt. Calves with diarrhea from disease agents are going to be depressed, off feed to varying degrees, tired, weak. They may have a fever. Their ears may be down. They're going to spend more time laying down when their pen mates are up walking around and active. Calves that are healthy and just have a little bit of loose manure, especially calves that are fed on a really high amount of milk, they're going to have looser manure in general. Those calves really don't worry me if they're loose. I've seen calves drink up to 18 to 19 liters of milk in a day on calves that are fed on ad-lib milking systems. So that's basically an auto feeder, and the calf can come up whenever it wants and take a drink. So those calves are going to have loose stools. There's just so much volume coming through them and so much liquid, so much water. It's really hard to actually have a solid bowel movement for them. So you're going to have a lot more calves with loose manure there. And just look at the entire calf, not just the manure, to make the call for treatment. If the calf is a little loose but happy, coming up to see you, looking for their milk, chewing on your fingers, that's a calf I'm really not worried about treating. If the calf's laying down in the corner, has a wet butt, depressed, doesn't really feel good, that's the calf I'm going to target for treatment. What are the agents? There's a whole bunch of those listed here: rota virus, coccidia, cryptosporidium, coronavirus, clostridium, salmonella, and E. coli. And we can really diagnose a lot of those by the clinical signs. What does the calf look like? So going down to the bottom here for the bacteria, such as salmonella and E. coli, those are gram-negative bacteria, and they tend to be a hammer blow to calves. They look very ill. They are down and out with extremely high fever, sometimes bloody diarrhea. And they can go from healthy, bouncing around in the pen, ready to eat, to laying on their side, ready to die in about 12 hours. E. coli typically is in the first week of life. K99 E. coli especially. Salmonella can infect anything with a spine for the most part, but typically see that in younger calves where it affects them the most severely. And some of the sickest calves I've ever seen in practice were actually Salmonella Dublin calves. They were on an Amish farm. They were so sick you'd actually just push them over. That's a typical presentation for a gram-negative bacteria like Salmonella. But again, I can usually tell by the clinical signs what the calf looks like and its age as to what agents it has. Going up to the top of the list, like rotavirus, typically we're going to see that at about a week to 2 weeks in after birth. Coccidia takes about 3 weeks for it to develop. So if we see a calf that's a week old and you might think it has coccidia, I would probably think twice about that, because due to the life cycle of the coccidia protozoa, it takes about 3 weeks to develop from ingestion for the calf. So you really can't get it before that time. Cryptosporidium is another parasitic agent, just like coccidia. Most likely you're going to see that a week in to 21 days later. So again, if I know the age of the calf and I generally know the clinical signs that I'm going to see in those animals, whether it's what kind of diarrhea, what the calf looks like, I can make a pretty good educated guess as to what the calf does or what the calf has without actually having to set out or send out some diagnostic samples. And if you're not sure if you have diarrhea outbreak, by all means, call your veterinarian in. We love doing these kind of investigations. I do them on our dairies all the time, is to figure out what we're dealing with. Just as an example, we've had some wean calves in our research dairy that have had some diarrhea and loose stools. Grabbed a bunch of samples from them, and lo and behold, we have some coronavirus going through them. So again, just didn't really know what was going on. It really didn't match our typical age range where we see coronavirus, so I took samples. But again, good to take a look if you really don't understand what you're dealing with. But this chart, especially this one here from NC State in Extension, is really handy for me if you want to go out and learn what they might have. This chart contains calves with clinical signs from pneumonia, also and diarrhea. So it's really nice scoring criteria. Normal would be on the left, sick would be on the right, and that includes a respiratory disease score like nasal discharge, 0 with 0 nasal discharge to copious bilateral mucopurulent or white snotty discharge on the right. We talked about conjunctivitis or eye signs with pneumonia, normal on the left, really nasty crusty eye on the right. Ear scores, bright and alert, responsive calf, got its ears up, following you around the room, listening where you're going. As they get more depressed, the ears drop and they may go, both ears may go down, or one ear may go down if they have an inner ear infection. And then there's some fecal scores here, normal on the left-hand side to pipe stream, watery diarrhea on the right-hand side. But this is a really nice scoring chart you could use, especially if you have large groups of calves that you're feeding, to score them and determine whether you want to treat them or not. So let's say we get a calf or groups of calves with diarrhea. What do we do about it? How do they actually die? I ask my students this all the time, and we talk about different diseases like tetanus and pneumonia and things like that, is what's actually the clinical cause of death? Well, dehydration in these calves is the big killer in diarrhea. they really need water. Okay, they rapidly dehydrate. We've got this graph here on the upper right-hand side of a calf with 6% body total body water loss, up to 8%. These are calves that are flat out and can't get up. At 14%, it's fatal. So that loss of water is probably the most critical part, and that really triggers what we want to do in terms of treatment, which we'll talk about in a little bit too. Loss of electrolytes also is a big killer. So they lose sodium, they lose chloride, they lose potassium, they lose bicarbonate. They get some really weird acid-based disturbances in their blood, in their body. Their blood pH, which is normally around 7.4, drops to 7.3 or 7.2. And you might not think that's a lot, but remember, pH, if you remember your chemistry, is logarithmic. That's a lot of hydrogen ions they're getting in their blood. Calf that goes from a 7.4 to a 7.3 blood pH feels really bad. They will look really bad in front of you. So those disturbances in electrolytes can also contribute to heart failure in calves if they're severe enough. So we're going to treat our calf based on what they look like given the clinical signs in front of us. A big way to determine dehydration, some of you may have already done this or know how to do this, is eye set in calves. Cattle have a really nice fat pad behind the eyeball, in between their eye and the skull and the orbit. When they get dehydrated, whether that's a calf or an adult cow, that area sinks in. This calf on the left-hand side, this red Holstein, it's got a nice, bright, clear eye, plenty of moisture in the eye. It's pushed out. This calf on the right-hand side is probably 10 to 12% dehydrated. You can see the bony orbit protruding just where my mouse is circulating, where I've got these arrows pointed. The conjunctiva of the eye is kind of rolled in towards the eyeball. It's sunken in. That's a very dehydrated calf. So just looking at how their eyes set in can tell you how hydrated they are. You could also pinch that skin above the eye, and if it folds back down really quickly, like it probably would on this calf on the left-hand side, they're probably pretty well hydrated. But if you pinch it and it stays up for a long time, several seconds, you know that calf is significantly dehydrated. So what are we going to do for calves that are, let's say, mild to moderate diarrhea? They're still walking around. They're just feeling a little punky, not super interested in their milk, a little bit of mild depression. They may have a fever. They may have a 104, 104.5 fever. They may have nosed in their milk or drinking part of it. These are the calves that are really going to work on fluid loss from an oral perspective to start. We're going to feed an oral electrolyte, and I'll show you a nice chart of those that I like to use and show it and share with people. And we're going to mix that electrolyte with water according to the label directions. We're going to feed that between our milk feedings. We feed in the morning, let's say at 8 o'clock. We're going to feed this around noon, and then we're going to feed another milk feeding at night. We want to try to stay away from the milk feedings generally for most types of milk, for most types of electrolytes, because they can interfere with milk clot in the abomasum. So when the calf drinks the milk, it goes into the forced stomach and it clots up for digestion. Some of our electrolytes can disturb that. So we want to try to keep our electrolytes away from feeding with milk, even though some of them are labeled for that. We can give electrolytes via bottle. If they'll drink it, great. Or if they bucket, if they suck it down, awesome. Or we can actually tube them via an esophageal tube. It's very easy to learn how to use an esophageal tube in a calf. They come with nice little ball ends on them. You can feed down their esophagus. We should continue to feed milk at all costs to these calves that have diarrhea. If you starve them, if you pull them off milk because you think the milk's contributing to diarrhea, you probably will kill them because they just don't have the energy reserves. They need that extra energy that comes from milk. If you have to tube the calf to deliver that milk, so be it. But we got to keep them on that nutrition to keep their immune system going. You could also give an NSAID like Banamine for fever reduction and to make them feel better. I'm not really throwing antibiotics at these kind of calves, especially. There's typical parasitic or viral types of diarrhea for these mild to moderate diarrhea cases. I'm not reaching for that injectable antibiotic here. In cases that are moderate to severe, these are calves that are down. They're unable to get up. They may be on their chest. They may be flat out like this Holstein in the upper right-hand side. You can see, it's kind of hard to see with this picture, but the eyes on this calf are super sunk in. This calf would probably be, if you walked up on it in this stage, would probably be dead within a matter of hours if you didn't intervene. They may have signs of cold shock, cold ears, cold feet, not interested in milk. They may not stand if you try to pick them up. These are calves that are extremely ill and they need immediate IV, intravenous fluid resuscitation. I can train people how to do that. In a lot of these cases, you need a veterinarian to help you. I enjoy giving calves IV fluids. This picture on the lower right-hand side is me at our campus dairy a few years ago, IVing one of our Jerseys that got sick. Okay, we're going to give them about 3 to 4 liters, so about a gallon of fluids at a time, IV in a big, rapid bolus. You might think that's a lot of fluid for a small little calf, but they actually have a lot of water in their body. When they lose it, we need to correct it. We also need to have those fluids contain an alkalizing agent, something that's going to bring their blood pH up, and I'll talk about that in a second. We also need when we get that calf resuscitated, we give it IV, and that calf starts to move and shake and warm up, is actually get some milk into it via tubing if it won't drink it. So give it IV fluids, get it milk, give it some flunixin, some Banamine, Prevail, whatever that generic flunixin product is, make them feel better. And we may give antibiotics if we suspect that it's E. coli or Salmonella, especially if they have a high fever, if they have bloody diarrhea. We may just go ahead and give antibiotics, but that depends on the signs that I see. So we talked about electrolytes, and this is a popular topic amongst the dairy calf world, is which one do we use? My go-to guy is Dr. Geoff Smith, was at NC State for years in clinical sciences there, and he is one of the world experts on calf electrolyte therapy and calf diarrhea therapy. The problem with a lot of the older electrolytes that have been on the market for years for dairy calves is they're really based on human formulations. They're made for human infants with diarrhea, and human infants physiologically in a diarrhea state are much different than a calf. So Jeff came up with these recommendations several years ago in terms of what he likes to see in terms of the amount of sodium, the amount of amino acids, the osmolality, that's the ability of the powder to draw water, or how potent or strong that powder is, and an alkalizing agent, that ability to bring the blood pH back up to 7.4 in that calf. And these are his suggestions here. Blue light replenish is what he really likes. I use DiaQ, which is lower on the list, but a lot of good recommendations there. But you really want to make sure that particular electrolyte has enough sodium to replace the sodium they're losing, has the right osmolality, that's the MOSM label here, in the 400 to 600 range, has bicarbonate or acetate in it to help bring that blood pH up. Some of these are labeled to be mixed with milk. I typically don't recommend that, because the key point of treating diarrhea for me, like I said, is to get fluids back into them, and just feeding them milk on their normal schedule and not adding any other water in anywhere in the process into that calf really isn't helping us. So I recommend feeding that electrolyte with water as a separate feeding to really just get more water volume into them. IV fluid therapy, this is what I'm typically going to do as a veterinarian, although you can learn to give IVs. They're really not super hard to do. Is we're going to give, for that calf that's down and out and really sick, a 3 to 4 liter or 1 gallon of IV saline bolus. Typically, we're going to add 150 to 200 cc's of this injectable baking soda, basically, sodium bicarbonate IV. That's a nice resuscitation treatment protocol that I use to bring calves back from the brink of death many, many times. It works well. We can also give simply 200 cc's of this injectable sodium bicarbonate to a calf, and then give them a huge bolus of oral fluids. We can tube them with oral electrolytes. That's also a really big bonus. When you give high strength IV sodium bicarbonate in the vein, it will actually draw water into the blood vessels. So if you actually put a bunch of water into their gut via a tube, it will pull it into the blood vessels and also rehydrate them that way. You could also make custom-made isotonic or regular strength sodium bicarbonate, and I do that all the time with baking soda and sterile water. Custom-made IV fluids is what we do frequently. You can also add sugar or dextrose to those treatments to help bring the energy up to those calves. And if it's cold, like typically this time of year, if we have a calf diarrhea, I like to warm those fluids up to about 100 degrees Fahrenheit just to bring the temperature, base temperature of that calf up too, especially if they've been outside and chilled down. How long do we treat them then? If we have mild to moderate diarrhea, typically oral electrolyte feeding once a day, maybe twice a day for 2 to 3 days is sufficient, brings them back. If it doesn't resolve, we should continue that fluid therapy and seek veterinary advice. Why does that calf still continue to have diarrhea? But keep feeding milk. That's what this gentleman's doing here with this esophageal tube feeder. He's passed the tube and he's feeding a bag of milk to that Holstein calf. If they're moderate to severe, that initial IV fluid bolus, that's what this Jersey calf is getting in this picture here. Once we get that calf up and walking around, it's kind of amazing. You can walk up to a calf that's really cold around the edges, won't lift up its head, really sick. You give it a bolus of IV fluids, and it pops right back up with a warm nose within a couple hours and ready to eat. But the relapse potential is great there. So we need to keep giving that calf oral electrolytes and keep giving it milk to get it through that phase, typically for about a week. Medications. So antibiotics, I typically don't reach for these in most cases in mild to moderate diarrhea. Again, they're usually viral or parasitic. So they're Cryptosporidium, they're Coccidia, they're rotavirus or coronavirus. So antibiotics really aren't indicated in these situations. If we're feeding antibiotics in our milk replacer as a standard practice to all our calves, it's really not a good idea to do that. It's a poor management practice. In the veterinary community, we start to frown upon this. It's not a judicious use of an antibiotic. If we have a case that we think could be Salmonella or E. coli, we should think about using an antibiotic, but we should also get a culture of that Salmonella or E. coli case to see if it's actually resistant to a lot of our common drugs, which many of them are. So if we're going to use a drug, let's make sure it's actually going to work. In terms of coccidiostats, these are drugs that are going to treat coccidia like Port. I've got there in the lower right-hand screen. We could use those on individual cases of calves with coccidia, especially wean calves, which is very common to see. Or we could actually give oral treatment to the entire group via water system, or actually we can put it in their milk replacer and it works pretty well that way. Other medications we might want to try for diarrhea in calves, NSAIDs. So Banamine is one of those. Flunixin is the other trade name for that. It's helpful in reducing their fever, and it's better than meloxicam in bringing their fever down and making them feel better overall, hopefully to get them back on the milk. Probiotics, there's tons of those in the market in various different forms and powders and pastes that you can give to calves. I think they're healthy and I think they're good, but you typically need to give them every day during those bouts of diarrhea to keep the amount of probiotics levels up in their gut to help restore their gut balance. If we're dealing with a cryptosporidium outbreak in calves, there aren't any approved drugs that we have in the U.S. that can directly kill cryptosporidium. Our Canadian friends to the north have some, we don't. So typically we have to continue feeding those calves, and that's typically a sign of calf health. If they have cryptosporidium, they're typically being underfed. So we're going to look to increasing the amount of milk being fed. You can also feed oral supplements. There's a couple here in the lower right-hand part of the screen and have IgY proteins that can help bind cryptosporidium and help reduce the shedding out in the environment. So there are a few things you can use to treat cryptosporidium indirectly with antibody proteins. But again, typically no drugs available to treat that in the U.S. How do we prevent diarrhea? Number one, ensure colostrum intake, right? Incredibly important for dairy calves. We can vaccinate the cow to prevent a lot of these viral and bacterial diseases after they're born. Rotavirus, coronavirus, E. coli, these two products in the upper right-hand side of the screen. We can vaccinate the cow at 4 to 6 weeks pre-calving, and a lot of dairies already do this. And when she delivers that calf, she'll have antibodies to those particular agents in her colostrum, and it'll protect the calf. We can also use these oral boluses, these first defense shield boluses. They contain IgG. It's an oral antibody we can give in a large pill form to the calf at birth that can protect them from E. coli, rota, and corona. We can also use coccidiostats, and I recommend use those definitely in crete feed. We're trying to get calves weaned. You can also use them in milk replacer as well. One of the biggest things is just feed calves. You feed them on a high plane nutrition, and I don't want to steal Jason's thunder, but again, really got to feed calves more to keep them healthy. We got to keep their equipment clean, make sure we have a routine for cleaning our buckets, our bottles and nipples, get all that scummy layer of spoiled milk out of them, that slime layer, scrub it up, sanitize it, dry it out, get it clean and ready for the next group of calves. If you're buying calves, buy them with a known colostrum intake. Guarantee that in your contract or agreement with that particular dairy producer, they've gotten colostrum. Ask about vaccination status of the cows. What are they getting before they calve? Try not to overcrowd pens if you've got calves, wet calves that are in group pens. The typical thing in the dairy world is to cram a few more calves if we can in a pen. That leads to a lot of health issues. Again, ensure proper ventilation. That's important as well, especially calves that are on a high plane of nutrition, eating a lot of milk. They will have a lot of manure, and that wet manure can build up pretty quickly. Another suggestion I have is to use calf coats. This time of year, and actually most of the time of year, calves are burning energy to stay warm. So if you put a calf coat on them, which costs you maybe 150 to 200 bucks for several months, or at least the first 2 months of life while they're on milk, it can really provide a lot of benefit where they're spending less time trying to stay warm and using more of that energy for that expensive milk you're feeding them to gain body weight. And protocols, right? I really encourage you to work with a veterinarian to develop a vet client or VCPR, vet client patient relationship. So that's the person that's going to come to your farm, has knowledge of your animals, can provide you with prescription products, which you're going to need if you're going to treat these animals. But we can develop written treatment protocols for really common diseases like the two we just talked about, pneumonia and diarrhea. Here's the case of XYZ. These are the clinical signs you're going to see. Here's what we're going to treat with on this farm. And if these don't match up with what you see, here's my phone number and call me. And also development of treatment records. Write down what you treat calves for, what slaughter withdrawal and things like that, and discuss expectations with your veterinarian. When should I call you? When should I not? It's really important to set up that relationship. With that, I think I'm done. Jason and Garth, I have a question slide, but I think we're waiting until the end for questions, right?
We got a couple here in the Q&A thing as Jason loads his presentation. One of them was mentioning under feeding calves, the risk factor for illness, and kind of moving into what Jason's going to talk about.
Yes.
What kind of volume's adequate? As long as we follow the label and the milk replacer, are we good?
I typically feed more. I typically looking at, like, for modern Holsteins, at least 3 to 4 liters twice a day. And sometimes you can go 3 liters 3 times a day. I know some dairies that are feeding 3 or 4 liters 4 times a day. So more is better, in my opinion. As long as it's mixed properly, the more the better. But I don't want to steal Jason's thunder because he's going to go through some details on that. So
yeah, we'll dive into that one a little bit more when we get into
Yep.
milk replacers and feedings.
Got one early on cost. When will we see a turnaround in the cost of calves? We got a kind of a fixed supply of dairy bull calves currently, and the beef cattle prices look to be good for at least another 2 years unless something unforeseen happens. So really not looking at a whole lot of turnaround in the next couple of years in terms of price and cost of Holstein bull calves or even beef feeder calves at this point. We'll leave this one to Justin, and we'll jump to Jason here. Got a question from a 4-H'er, it looks like. What can we do if we have a calf that bloats?
if it's a young calf, you typically need to have that seen by a veterinarian, especially a calf that's on milk, because those can be pretty major signs of a Clostridium infection, especially a really young calf that's on milk. For older calves that are weaned, typically we need to pass a stomach tube and try to get that gas off. So it depends on the age of the calf. But again, that's an animal that needs to be seen by a veterinarian, especially a young calf. Those are pretty serious on those younger guys.
And there's another question I think Jason will get to. Question about feeding whole vitamin D milk from the store, other sort of mixtures with eggs, yogurt, cream, those type of things.
Yeah, I can dive into that just a little bit before we get into the presentation, but that, feeding that red cap milk. So red cap milk is whole milk, somewhere around, there's a little bit of differences based on processors, which is why you actually causes some of the flavor differences in whole milk, but whole milk standardized is 3.25% fat. And that is an option. Really, I'm looking for a little bit higher fat content milk than even whole milk. When we think about feeding whole milk to calves, pasteurized milk, and what we see on a lot of dairy farms, we're really going to dive into the milk replacer feeding system. But that can be an option, buying that red capped milk, or we still have to make sure we're feeding enough of it. And we're not starving these calves. And when we see that bloat, as Justin talked about, in those calves that might still be on milk, there's some nutritional things that we're concerned about, or really our protocols on how we're handling our milk replacer that I'm going to be really concerned about, that sometimes leads to some of that clostridial bloat that we need to look at and we're going to discuss. So tonight I'm going to be talking on, feeding dairy feeders from the nutrition standpoint, equipment management, and even getting into a little bit deeper into ventilation. But I really think about it as changing our system. We used to feed calves so that they survived. The goal was, how do we get this calf to survive? How do we get it to about 6-7 weeks of age when it's finally the rumen's going to be developed enough that it's going to start ruminating? Our goal today needs to be, how do we make these calves thrive? How do we make them grow to the tune that we're really looking to double that weight of a calf between birth and weaning time? So what I'm really going to cover, things, what is temperatures comfortable for a calf? We have to understand that to really understand our nutrition programs, our ventilation management, what our goals are there, the importance of feeding the right amount of milk. And how much we really need for a calf to grow, to move from that trying to keep a calf just to survive, to get that calf to thrive and grow. Talking about protocols to keep milk consistent, sanitation of that milk feeding equipment. Justin set that up really nice. As to that's super critical, that we make sure this equipment is clean. If you think about setting a milk jug out on the counter, just set it out. If you don't believe how important milk equipment cleaning is, drink your gallon of milk, set the jug on the counter and don't rinse it out, and open it up 12 hours later. It's going to be blown up just a little bit, and it's going to have that smell of rotten milk in just 12 hours of sitting on the counter. Well, the same thing's happening with our calf feeding equipment. It's just not held inside a contained vessel, so you don't end up noticing that smell. We're going to talk a little bit about selecting feeding calf starters, and then move into some discussion on weaning, and then kind of finish off with ventilation, because that's a really big part of calf raising. I walk into so many calf barns this time of year where we have them buttoned up tight as a drum, and it's causing the respiratory distress problems that they're seeing on these farms. So first, what temperature does a calf start to use energy to stay warm? Our goal isn't to keep our calf barn at this temperature. Our goal is to keep a calf growing. So we have to understand when we need to provide that energy, when we need to provide that calf jacket that was talked about. So that temperature when a calf starts to burn additional energy to stay warm is known as that lower critical temperature. Over there on the right, that goes down basically every day after a calf's born. When that calf's first born, 56 degrees is about its lower critical temperature. It's going to utilize some of that energy from the milk we're feeding it to stay warm below that. We're really not concerned about that calf down to 50 degrees. Really, we can manage these calves very well down to about 32 degrees. That thermal neutral zone, that's that temperature range when that calf uses no additional energy to maintain core body temperature. So when we get too warm out, we have heat stress, we actually utilize energy to try to keep that calf cool, which is that panting action. And things to think about on a calf. So a calf's born with only 2 to 4% of its body weight as fat. So if a calf doesn't get enough calories from milk, it has to burn some of that fat. So when we're in these temperatures today, if we're not going to be feeding enough milk to maintain that calf, whether it's growing or at least to meet its maintenance, it's going to have to burn fat to maintain temperature, and there's not a lot of fat to burn. So then when that calf is challenged with anything of the immune system, it doesn't have those resources it needs to overcome disease, and we get those rapidly escalating scours calves and rapidly escalating respiratory cases. As calves begin to eat grain, they begin to ruminate. When they start ruminating, think of the rumen as a big furnace. At that point, it starts to produce heat, and that heat helps to keep the calf warm through rumination, even without really burning a lot of extra energy. Once a calf reaches 2 months of age, that lower critical temperatures really drops to 32 degrees once that calf is weaned. We're not really burning any extra energy. So managing that cold stress, what do we need to think about? When we're managing cold stress, our first goal has to be to maintain good air quality. And then we move into how to keep the calf warm and preserve body heat beyond feeding a high plane of nutrition. So really that first step is going to be to utilize those calf jackets. $100 to $150 for a calf jacket is a really reasonable investment when we think about buying a $650 to $1,000 calf. General rule of thumb is a calf needs a calf jacket anytime that if you leave a bucket of water sit outside, it's going to develop a skim of ice overnight. We can usually leave that calf jacket on all day. There are going to be a few instances where we're going to move into some warm spells where we're getting up into that 50 degrees during the day. And those calf jackets may actually cause those calves to sweat. We might have to do a little bit of extra work taking calf jackets off and then putting them back on. When we reuse those calf jackets and bring in multiple groups of calves, we want to make sure that we wash those jackets really well. They can be a pathogen vector from calf to calf. If we launder them in hot water with good detergents, we can kill those pathogens, clean them up very good, and they're not a vector, and we can continue to use them. The next really important thing is to provide deep bedded straw to these calves. We want to be able to have a good nesting score. So a nesting score is looking at that calf laying in the pen and how much of the leg is visible. Typically, if you want to think about some rules of thumb, when you bring a calf home, you want to put about 25 pounds of straw in a 4x8 pen for that calf to give it a good solid foundation and base. Then we're going to need to add 2 to 3 pounds of straw per day to be able to soak up any moisture from the urine and feces of that calf and keep that straw nice and fluffy for a good nesting score. You should be able to drop to your knees in a calf pen after bedding it up, and you're going to stay dry. If you pick up moisture on your pant legs when you drop to your knees in that pen, you don't have enough bedding present. So we look down here at the nesting scores, trying to decide how much straw to utilize. In the summer, we can have a nesting score of 1. So legs are entirely visible when that calf is laying down. We really aren't trying to maintain body heat. When we're in that 50 degrees to 35 degrees, we might be looking more at a nesting score of 2. So if you look at this calf, the legs are partially visible when it's laying down. Those legs sink down into the straw. And tonight, if I was out bedding up calves, I'd want to make sure that we have this nesting score of 3 in all of our pens. So that's going to be a calf that's going to lay down. Its legs aren't going to be visible anymore. That's going to help it maintain that body heat overnight. We put a calf jacket on it. We're going to do a really good job of helping that calf stay warm and not have to use calories. The flip side, when's a calf under heat stress? When do we go over that thermal neutral zone? So that newborn calf to 1 month of age, that thermal neutral zone we consider to be about 50 to 77 degrees. If we're over 77 degrees, we may want to look at providing some form of supplemental cooling beyond just natural airflow, but we have to be careful how much airflow we get. From 1 month to 2 months of age, about 32 degrees to 73 degrees Fahrenheit is going to be that thermal neutral zone where we're not really burning calories to stay warm. Some signs of heat stress to look for: calves that have reduced movement, decreased feed intake. A hot calf isn't going to drink its entire milk meal. So in the summer, that's another one of those things to keep in mind as you're going through and trying to figure out why a calf didn't drink. Is it under heat stress? Does it have respiratory symptoms? Does it have diarrhea? Should see increased water consumption on these heat stressed calves, and water is absolutely critical. Even in the winter, water makes up 75% of the weight of a calf. It's absolutely critical to be providing water. We're going to see increased respiration rates. Open mouth breathing is a really obvious sign that we're under heat stress, and we need to provide some form of mitigation. If you're around the calves a lot, you're going to see increased standing and less lying time, which isn't good for that calf either. But when it's standing up, its body dissipates heat better to help with heat stress. So when we think about cold stress or just feeding calves in general, how much milk does that calf need? Can I get a calf to survive and thrive on 2 quart of milk night and morning, so a gallon of milk a day? And we start talking about increasing planes of nutrition. The old standby is a 20-20 milk replacer, 20% protein, 20% fat. Today, we're moving to some different milk replacers that are high protein, up to 27%, 22% fat. Or in some instances in the summer, we'll do a 27% protein. We'll lower that fat down to about 17%. And by doing that, fat creates more heat when it's digested. Put in some carbs into that milk replacer. They still are getting the energy they need, just from a different source. But when we look at how much milk does that calf need, so if I'm going to feed a calf 4 quarts per day, so we've come across at 4 quarts per day, thermal neutral at 50 degrees, we're going to meet that calf's maintenance needs at 4 quart, but we're going to have real issues with that calf gaining just 1 pound per day. The goal is really for a calf to consume a minimum of 10% of their body weight. So that means on a calf that weighs 100 pounds newborn, we want it to be drinking 10 pounds per day. And 1 quart of milk weighs about 2.15 pounds per quart. So if we're feeding 6 quart, we're going to be meeting that goal. But if we're only feeding 4 quarts per day, we're not going to meet that goal of 10% of body weight. And we look at that 80-pound calf, we come across on that calf when it's 10 degrees out, we only meet maintenance, no gain. But what about the Holstein calf that most of us are going to be raising? Well, at 30 degrees, so not tonight, at 30 degrees, that 4 quart per day just hits our maintenance. Absolutely no growth on these calves. If we're looking just to grow 1 pound of gain per day at 30 degrees, we really need to be feeding a minimum of that type of milk replacer at 7 quarts per day. When we get down to 10 degrees, if we want that continue that gain, we need about 7.5 quarts per day. At thermal neutral, we can gain 1 pound per day by just feeding 6 quarts, but that old 2 quarts doesn't even get us there. When we think about Holstein milk, it contains about 25% more energy than that 20-20 milk replacer. So we're really underfeeding these calves. In Holstein milk today, we're really talking about a 4.5% crude protein and about a 4% fat, 3.2 crude protein. So, we're not meeting that cow's milk by feeding a 20/20 milk replacer. Jersey milk is going to contain about 50% more energy than that. If you happen to be buying crossbred calves, their portion of that calf that's coming out of the Angus breed, it's more nutrient dense than a Holstein. It's going to be closer to that Jersey nutrient density. So we need to be thinking about that because that calf's genetics are really set up for a much more energy dense milk than what Holstein milk is or our milk replacers. So how much should a calf grow from birth to weaning? I mentioned that, a 20/20 milk replacer feeding 6 quarts, we can gain a pound per day. Is that enough? The goal for a calf is really to double its birth weight by 8 weeks of age. I know we have some 4-agers on tonight, and a lot of times we see a 4-age weight at fair at 300 to 350 pounds, and we're buying these calves 4 to 6 months before fair. At 2 months of age, I should have a calf that's a minimum of 200 pounds. If we're not hitting that 350, 400 pound mark by fair, we have a nutritional deficit in those calves that we really need to look at, or we had some real disease issues that held them back that we need to be discussing. Look at other things besides weight. How much should that calf grow? Their hip height should increase a minimum of 4 to 5 inches by the time they're weaned. So if a calf only gains 1 pound per day, we feed that calf on average for 56 days on milk. That 100-pound calf's only going to weigh 156 pounds. We didn't hit that goal of doubling weight by 56 days or by weaning. So we need to go back and look at how can we feed more milk to these calves? What can we do for a higher plane of nutrition, which comes to feeding those higher fat and protein milk replacers, so we're closer to actually matching what a cow produces to hit our weight goal, our gain goals. So really, when we start thinking about these programs, we've gone from thinking about how do we just get that calf to survive on the grain and feed them as cheap as possible, but how do we start to mimic what happens in nature? If it's a beef herd, that calf goes up, it's going to drink a lot of small meals per day, about 4 to 6 meals per day, and on an automated feeding system, that's even what we see out of a dairy calf. How do we do a better job of mimicking that, though, when we're bottle feeding? Maybe slightly larger meals, but also looking at more meals per day. Another thing to take note of on these pictures, if you look over at the calf that's drinking off of the cow, notice the position of its head in that S curve to its neck. We're going to look at that a little bit more. But when we're feeding these calves, we need to keep the head close to level with the back line. We often see, especially bottle feeding calves or putting them on a nipple bucket, we're putting those way too high, and that actually influences the way it drinks. And we don't get proper milk flow down into the abomasum through the esophageal groove. So what height should a calf nipple bucket be or bottle? A newborn calf, you're looking at 24 to 27 inches, slightly higher than the average adult's knee. If we hold that too high, what we actually do is the calf will gulp air. We get a little bit more milk potentially that may actually go into the lungs. Then we're going to increase those pneumonia risks. So if we look at these 2 calves over here being bottle fed, you have the Jersey. It's got a slightly, we call it an S shape to the neck. That head's staying right here at that back line. And then the nose is pointed up. That really helps get the esophageal groove to work. A calf is designed so when it eats starter, it's supposed to go into the rumen, but when it drinks milk, it notices that milk. The esophageal groove opens, it bypasses the rumen, and puts that milk right into the true stomachs, into the abomasum. And that's what we want, because if milk ends up in the rumen, we're going to actually get fermentation of that milk, and then we're going to have some of those bloat issues that was mentioned a little bit earlier. And that calf just isn't going to feel good because it's going to have rotten curdled milk in its rumen where it doesn't belong. So we need to see that over here on the Holstein. We see they're holding the head, which is good, supporting that calf while they're feeding the bottle potentially, but this head is way too high. Look at how much higher the pole in the ears are than where that calf's back line is. We need to get that head down so that it can drink properly. So to look more at these milk feeding programs, why do we want to feed a higher plane of nutrition? Well, it offers 2 advantages. One, we're going to get better rate of gain, which is really positive. In the dairy industry, that translates to more milk production during first lactation, also translates to earlier puberty, earlier breed back on these animals so they spend less days just eating as heifers, and we get them milking sooner. But when we think about the beef side, That's going to mean less days on feed. It's also going to mean a healthier calf, less need for antibiotics, treatments, easier to overcome both scours and respiratory disease. But we do have to learn to look at manure a little bit differently and to score that, because they may have slightly looser stools on some of these really high protein diets. When we look at starter intake is going to be slightly different when we're feeding a proper plan of nutrition. A calf doesn't really start ruminating until about 6 weeks of age over here. We'll see some starter intake before that, and it'll be digested, but we're really not going to get good rumination till that 5 to 6 weeks. But on a high plane of nutrition, we're meeting their nutritional needs with milk, which is what nature would do, instead of trying to force them onto starter. When we look at this graph, you're going to notice that the control and the moderate diet follow a very similar starter intake, ramping up, really starting about 3 weeks of age, and they really continue to ramp up at 6 weeks. When that calf starts ruminating, it ramps up rapidly to 8 weeks. But if we're on a high plane of nutrition or a more aggressive diet, what we're going to see is starter, we're going to start increasing. We start to see a deviation, though, where that high plane of nutrition doesn't eat quite as much starter, but still at 6 weeks of age, when that calf starts to ruminate, it rapidly increases. And as long as we wean that calf properly, by 8 weeks of age, its starter intake is matching that low plane of nutrition, and it's going to transition and continue to grow rapidly. We're going to see that calf outpace growth compared to those lower nutrition programs. That control program would be a 20-20 or a 21-21 milk replacer, fed at about a pound per day. So that's that traditional milk replacer that came with the 8-ounce cup. You put a scoop in 2 quart of milk. And if we look at average daily gain, you see a huge difference here. But basically, they don't gain anything. They just live. Some of the calves will gain about 6/10 of a pound per calf per day. But that average is less than 0.2 of a pound per calf per day. Put them on a moderate diet. So a moderate diet's about 1.5 pounds of milk replacer. That's going to be closer to that 3 quarts per feeding, or about 6 quarts per day. High protein, 27-17. This was a summer trial, a little bit lower fat in the summer, and they were replacing that with carbohydrates in this milk replacer. But we see a really nice increase here in average daily gain, looking more like 1/2 to 3/4 of a pound per calf per day, which is what we want to see. We get up to 2 pounds of milk replacer, closer to feeding about 4 quarts per feeding. That jumps up there to 6 to 7/10 of a pound per calf per day. And we're doing a lot better. We're meeting that calf's nutritional needs. And that's where we're going to start hitting that goal of doubling our weight by the time we wean that calf at 8 weeks of total age. And we're going to have a lot healthier calf. We can just feed more milk. That is definitely an option with that 20-20. Taking a 20-20 milk replacer and increasing that to 2 to 3 to 4 quarts per feeding, or adding in additional feedings. We're going to see additional growth by adding that additional milk. So utilizing the same milk replacer, if you look down at the calf's body weight, which is the blue line down here, by 8 weeks of age, which was weaning in this project, staying down below that 6 to 8 liters per day. You can think of that as pretty close to a quart. A liter is almost a quart. And we're just not really meeting that nutritional need of the calf. We get up to 10 to 12. 12 liters is what a calf fed ad lib on a free choice feeding system, a dairy calf, is going to drink. They're going to drink between 10 and 12 liters. So even when we're feeding 3 quarts per day, we're not actually, or per feeding and 2 feedings, we're not meeting what the calf would naturally drink. So when we look at our feeding systems and utilizing bottles, we need to keep the milk replacer to water ratio always the same. If we put more milk replacer into that water, we actually increase the solids content too much, and then we're going to get some of the issues. You're going to see increased scours, but you also may see some of the things like bloating. A lot of that comes from improperly mixed milk replacer. So the goal, you really want to feed 4 quart of colostrum to start with, and then 2 quart for the second feeding. And then for the next 2 to 3 feedings, so about 3 to 4 days of age, it's okay to feed 2 quarts per feeding as that calf digests that big dose of colostrum it had up front. But if those calves want more, it's definitely just fine to continue to feed up to 3 quarts per feeding on that calf up to a week of age. Small calves, we look at about 3 quarts per feeding. And then by 2 to 3 weeks of age, as that calf continues to grow, we can start to feed 4 quarts per feeding. The reason why we feed a little bit less to start with is their stomach just isn't big enough, and we can actually get spillover into the rumen, which isn't good either. And really, the ideal plan would be to feed these calves at least 3 times a day. Most of us eat 3 to 4 meals per day, along with snacking. Feeding calves in that same fashion is closer to what Mother Nature would do. 3 to 4 feedings for that high plane of nutrition. Top feeding rates come in right around 12 quarts per day, which is what that calf would naturally eat. Our high-fat protein milk replacers end up with a solids content of about 14 to 16%. Modern dairy cow is going to be producing somewhere between 12.5% and 14% total solids in their milk. So we're coming close or going a little bit above what the modern Holstein produces. The modern Jersey is going to be a little bit higher than that. And a Holstein Angus cross would normally be higher than that. So we want to try to meet that nutritional plane. How do we select the best milk replacer? When you're selecting milk replacers, quit looking at the price tag is my best advice, because this is an investment in the calf. It's not just an expense. A lot of times we look at feed as an expense. Well, this is an investment in the future of that calf and keeping it healthy and keeping it alive. The average Holstein today is producing about a 3.2% protein and a 4.1% fat milk. And a 2020 milk replacer just doesn't get us there. When we're looking at fat content in milk replacer, in the wintertime, feeding a little bit higher fat content is really beneficial. That increases that energy plane for the calf to keep it warm, so it has those calories. Looking at that fat content, typically between 18 and 28%. Going closer to that 28 makes a really good winter milk replacer. The most common, though, you're going to find is a 20% fat milk replacer. Higher fat content is just a little bit better. Now, the only time we may want to look down at that 17, 18% is in the summer. We found that a little bit lower fat milk replacer helps with heat stress. Protein content, 17 to 30%. The real thing to start looking at under protein content, when I say don't look at the price of the milk replacer, look at it as an investment, is there's multiple sources of proteins utilized in milk replacer. We really want to look for an all milk protein, instead of a soy-based protein that's in some of the cheaper milk replacers. That soy-based protein on a young calf especially, it doesn't digest as well. We get into 3 or 4 weeks of age, they can digest that soy protein a little bit better. But young calves are going to thrive on an all milk protein. But even in an all milk protein, isn't all made the same. So most of the milk protein used in milk replacer comes from whey. And depending what kind of cheese it came from, how that whey was processed, how that whey was dried, can change the protein availability to the calf and also change the amino acids a little bit. So looking for that high quality milk replacer. It's touched on for medicated milk replacers. Really today, I wouldn't recommend, you need to work with your veterinarian if you want anything medicated besides lactulacid. Lactulacid is that coccidiostat that can be in milk replacer. The other thing you may look for in a medicated milk replacer in the summer is a product such as Clarifly. What that does is that kills off the fly larvae that may be trying to live in your manure. So those are a couple of things to look for maybe on the medicated side, but the coccidiostats can be a good product for a young calf. If you have issues with coccidial diarrhea coming in at about 3 weeks of age, that calf really isn't eating enough starter yet, so we can put that in our milk replacer. How consistent your milk mixing? This is a big problem that we run into. The goal of most milk replacer is about 13% total solids, utilizing a 10-ounce milk replacer mix. So this was a study where they actually took a group of college kids and they had them mix up milk replacer. And this is the same thing we see across farms. They told them that they wanted 13% total solids. They gave them the cup that comes in the milk replacer that was 10 ounces. And they told them that they wanted to feed at 110 to 115 degrees Fahrenheit. And then to check that milk replacer, they utilized a thermometer after it was mixed to see if they hit the temperature correctly. And then they used a Brix refractometer to see how many total solids were in there to see if they hit that 13% goal. What did they find? Out of 41 kids mixing this milk replacer, they had a solids content range of 6% to 14.5%, and they knew they were being tested to see if they were hitting that 13% goal in the right temperature. Temperature range from 80 to 115 degrees. So nobody was feeding it too hot, but we were feeding cold milk. If we feed that milk below that calf's body temperature, it's going to have to burn calories to warm the milk up to get it up to body temperature. We can also have some issues with the fat digestion as it's going down and fat hanging up in the esophagus as that calf eats. Less than half achieved the correct total solids content, which was really to hit between 10 and 15%. Had a pretty big range. Only 2 of those 41 actually hit the goal precisely of having 13% total solids. And they were instructed on how much water to put in. They were given the 10-ounce cup. Only 2 of those batches actually achieved the correct final temperature between 110 and 115 degrees. So there was a lot to be desired in the consistency of that milk mix. And it's really, for especially diarrhea in calves, it's really important that they get a consistent meal every day at the same time to keep that calf healthy. So what do we need to think about? Consistency, consistency, consistency. In temperature delivered, the amount of milk delivered, and in the mixing of that milk. So can you just use that cup that comes in your milk replacer? The best thing to do with that cup when it comes is dig it out and either throw it away or wash it up, take it into the house and use it for you to drink out of as just a cheap cup, or put it in your shop or someplace out in the barn to use to drink. Don't use it to measure your milk replacer. It's basically worthless. The best way to measure milk replacer is going to be to actually weigh that milk replacer to make sure that we put the right amount in every time. I guess you could use that cup to scoop it out and set it on the scales. But that cup is not a good thing. You want to use a calibrated scale to weigh the milk replacer. When you go to mix, so you're going to mix that powder into 110 to 120 degree Fahrenheit water. You don't want to be too hot. Fat's good up to about 140 degrees. If we're mixing milk over 140 degrees, we can actually start to do some things to the proteins and the coagulation of that fat that we don't want to do. And that can be a whole nother issue that can make our calves sick. Recommend batch mixing, so mix up all the milk for the number of calves you're feeding at once. That allows you to weigh out a little bit larger quantity. If you're feeding 10 calves at 10 ounces, you're going to weigh out 100 ounces. So if you're off by 1 ounce, that's only a 1% error. Where if you're off by 1 ounce in a 10-ounce mix, that's a 10% error. So really thinking through that caution, mixing a bigger batch is going to be better. Just have to make sure you can get it mixed and keep it warm. We're going to start with about half of the total volume of water that we need. We're going to put the powder in on top of that water, and we're going to start mixing it. While we're mixing, we're going to add that remaining water to reach the total volume of solution we need to feed to the calves. Because if we're feeding 3 quarts, we don't need 3 quarts of water. Some of that's going to be made up by the milk powder. So having a really well measured out mixing container is really important. And then we need something so that we can measure that out. But during the mixing process, we need to inspect really carefully. If that milk doesn't get mixed into a nice uniform mixture and it has clumps of dry powder in it, that's going to cause some digestive issues in the calves, diarrhea, but it can also lead to bloat because that powder is going to lay in the stomach. It's not going to digest properly. So that has to be nice and smooth. We can mix it by hand. We're seeing more and more operations go to some form of electric mixer or a mixer like a paint mixer on a drill, so we get really good mixing of that milk replacer into the water. Need to make sure we deliver the same amount to every calf every feeding. For bottle feeding that calf, it can be pretty simple. We fill the bottle to the top. That's going to be the same amount to every calf every feeding. If we're bucket feeding, then we really need some sort of tool for dosing, whether that's a pitcher that we put the milk into to measure it out and then dump it into those buckets, or some sort of dosing pump that provides the same amount of milk to every calf every time. Feeding temperature. So we're going to mix between 110 and 120 degrees Fahrenheit, but that's a little bit warm to feed to the calf. We're mixing at that. It's going to cool off over time. Of course, it's going to cool off slower in the summer, faster in the winter. We want that milk to arrive at the calf between 101 and 105 degrees Fahrenheit. Having a thermometer wherever you're mixing your milk can be really beneficial to make sure we have the right water temperature to start with, and we're delivering that milk at the correct temperature to the calf. So some equipment you really need to do a good job of mixing milk and feeding calves. A scale to measure out that powder. Instead of using the cup, weigh it every time. You can look at it and say, okay, I can find a measuring cup that's going to deliver the right amount. Well, every time you scoop that milk replacer, you actually change the density and the pack of it in the cup. If you just scoop it up versus if you scoop it against the sidewall of the bucket, that's going to change the amount of milk replacer that you have in your cup. That thermometer to make sure we have the right mixing temperature and feeding temperature. Some really good whisks if you're going to hand mix, or else look at some sort of attachment for either a hand blender or a drill so you can do a really good job and make sure you never have powder still undissolved when you're feeding calves. We did a good job of mixing that milk replacer. We fed it to the calves. Question we often get is, do calves on milk need water, and when do they need to start getting water? Well, a calf's body is made up of 75% water. And the answer to that question is whether it's today and it may be 5 degrees tonight, or it's in the summer, a calf needs water from day one. Water is a vital nutrient for dairy calves. It's essential for weight gain. It's essential for biological function. It's essential to get them to start eating starter. So what's that difference between starting to provide water at birth versus just waiting until 17 days of age? You're going to feel like from birth to 17 days that you're basically providing water and dumping water, providing water and dumping water. But the reality is that calf's going to drink a little bit of that water, even in the winter. Be really good. The goal would be to feed them milk, wait about a half an hour, provide them water, and then take it away just before it freezes. If it's cold like this, sometimes the calves will lay down, so it may be better to try to provide the water a little bit closer to milk feeding. The reason why we don't just take the milk away and provide them water is we needed a little bit of time for the esophageal groove to close, because we don't want the water to go into the abomasum. We want the water to end up in the rumen where it belongs, so that when they eat starter, the water and starter mix together is the ideal goal there. So when we look at just rate of gain, how much are these calves going to grow, average daily gain between feeding them water at birth to water at 17 days of age. The at birth calves gain about 1.45 pounds per day versus 1.34 pounds. So about a tenth of a pound difference there in average daily gain by providing water at birth. Weaning, it actually seems a little bit strange, but right at weaning, the calves that were provided water at birth and were actually growing better tend to have a little bit lower average daily gain in a couple of different studies. But the real problem probably there's a weaning slump. So we're not quite weaning those calves properly in the study that led to that average daily gain being lower on the calves at birth because they were growing more rapidly. An accelerated growth program, we have to be careful how we wean so we don't see that weaning slump. The calves that weren't growing quite as well gained about 0.8 of a pound during the weaning phase. Post-weaning, that calf that received water at birth took off again, about 2.4 pounds of average daily gain compared to 2.27 pounds, about a tenth of a pound difference there. So what was the weight difference at 5 months of age? About a 38-pound weight difference just by providing water at birth versus waiting to 2.5 weeks. These calves need water. It doesn't matter if it's cold out. It's going to help them through diarrhea. It's also going to help them consume starter, and it's going to help them transition and support those biological functions of the calf. After we feed calves, Justin talked a little bit about that importance of washing. There's some real procedure to washing. It's not as simple as just take it and throw it in the dishwasher from the studies that have been done and from experience, or go wash them up in the sink. The first step is really to rinse our calf feeding equipment. We want to use between 90 and 100 degree water. We want to rinse off any dirt and all milk residue and milk fat that we can get off easily from inside and outside. We don't want to use really hot water to rinse. Really, we're good up to 140 degrees, but somewhere 150 to 170 degrees, we can actually bake the fat into the plastic feeding equipment that we use for calves, the bottles. So we want to be careful. About 90-degree water is really ideal for rinsing. The next step is soaking. We think about washing. You stick it in the sink, you scrub it down as fast as possible and move it on to the next step. The reality is everything's about contact time. So a chlorinated product, about 1% chlorinated with an alkaline detergent, something greater than 7% on the 7 on the pH scale at about 130 degrees. So we need hot water, hotter than you're going to want to put your hands in, which means you need a pair of gloves to protect your hands when working in these detergents and in this hot water. And really, we want to soak that feeding equipment a minimum of 6 minutes. Ideally, you would soak it for more like 20 minutes to allow really good contact time, because that's what it takes to kill these different pathogens that are making our calves sick. And we don't want to transfer from calf to calf, or some of that fat to be left behind and to grow bacteria between feedings. After that soak time, we want to make sure we wash things thoroughly. So it's not just soaking, then it's taking and washing them either and scrubbing them with a brush, or you can wash them in an industrial dishwasher for the bottles and buckets. Fat's going to melt away at temperatures greater than 110 degrees Fahrenheit. So we want to keep that water temperature high. If we're going to use a dishwasher, an industrial dishwasher, or even if you take them into your house and wash, you want all hot water. You want about 145-degree wash cycle. After we wash, we're going to sanitize. During that sanitation cycle, it kind of depends what acid solution we're using, but we need a big pH swing. So what we want to do is we want to start out with something alkaline, greater than 7 on the pH scale. That's going to kill any bacteria that thrives in a low pH environment. And then when we sanitize, we're going to flip that. And we're going to utilize a really low pH acid, and that's going to kill any bacteria that thrive in an alkaline environment. And that pH switch is really what does that work for us. Manually, our nipples, we want to soak them, but we also need to manually scrub them. Dishwashers don't work very well. The dishwasher doesn't spray enough up inside that nipple. We want to scrub the inside of the nipple with a little nipple brush that fits inside, and then scrub the outside. While we're scrubbing those, look for any cracks. Cracks are going to harbor bacteria, and also look for the end of that nipple splitting open. When those ends of the nipple split open, that calf's going to get milked too fast. That suckling action is really important. It produces some natural bicarbonates that help with digestion and maintaining pH balance in calves. So we don't want too big a hole in the end of our nipples. So watch for those starting to tear. If you take a nipple bottle and you hold it upside down for that calf to drink out of, and it starts leaking milk, the nipple's past its usage. It's time to replace that nipple and move on, get a new nipple out. Even if you really don't see cracks, the end of it's too big, and we're going to actually do some damage to those calves because the milk's going to free flow instead of them having to suckle it out like it naturally would. After we manually wash and sanitize, then we need everything to dry out. We want equipment to drain and dry before we use it again. We want to stack it upside down, but we don't want to stack it on top of each other upside down. Everything needs to sit on its individual shelf so air can move and it can drain out and dry properly. This time of year, if we're only keeping our calf mixing areas at 50 degrees, we're going to have some drying issues, which is concerning. But that really leads to that final step before feeding. The final step before feeding, think about re-sanitizing our equipment. And at this step, we actually encourage producers to utilize a 50 part per million solution of a product called chlorine dioxide. And that needs utilized within about 2 hours or less of feeding. And we want 60 seconds of contact time. So we can spray that on and allow it to have contact time. We don't have to really soak it for 60 seconds. We just need that contact time. The reason why we recommend chlorine dioxide, some of our different pathogens, that seems to be the only chemical that is an effective disinfectant against, say, cryptosporidium. It's a really hard disease to kill. It can be passed from calf to calf. Chlorine dioxide does have some efficacy at killing that pathogen on our feeding equipment. So that's a good additional product to add into our cleaning as that final step before we feed to make sure we have clean, sanitized equipment to use to feed our calves to keep them healthy. Moving into calf starter selections. There's a lot of different options out there for calf starters. So what's the best option? There's not one out there. It's not a one-size-fits-all type of solution to calf starters. It's going to depend what your milk feeding program is, how high a plan of nutrition, what the crude protein of that milk is. But the key to calf starter is we start offering calf starter on day one, and we only offer a small amount. If you look down here at the bucket at the bottom left-hand corner, there's a small amount of calf starter in there. Maybe we can just see the bottom. We want to keep it fresh. If that calf goes through and licks all the corn out of the calf starter, it's time to dump that starter, start over, give it some new. Typical recommendation would be to go through and change your calf starter out every week. If you have multiple ages of calves, that starter that you're dumping out, we have some disease concerns, but we do see operations that feed that maybe to their weaned calves. Typically, they would have experienced the same diseases and have natural immunity to your calves on milk. But also, if you have a calf that actively has respiratory disease, don't feed that to the weaned calves. That would be starter that we're just going to dump. Things to look for in a starter, we want to minimize fines. As you look across these different starters, we have pelletized starter, which can work really well. And we have that texturized mix that has cracked corn, rolled corn, steam flake, typically, and oats in it. Can also be very good. We see similar performance between calves with both of those starters. Like to see a decent amount of molasses in there. That seems to encourage intake. They like that sweet flavor. But if we look down here at the bottom left, top right, even over here, top left, or that second from the bottom right, you see a lot of fines. Fines are not good. We want to purchase a calf starter that has really low fines content. That fines, one, calves don't like to eat it with fines. And two, once it starts to ruminate, those fines are rapidly fermented. The rapidly fermented fines, all of a sudden, we can start to cause acidosis issues in our ruminating or pre-ruminating calves because they digest that too fast, spikes the energy. Just a lot of issues when we see those fines. So we're looking for either a high quality pellet that stays together and doesn't break, or a texturized product that has some fiber in it and still doesn't have fines. Those pellets aren't breaking apart. Protein content on starter. NRC recommends a minimum nutritional content of 18% crude protein. See a lot of calf starters up closer to 23, especially if we're feeding that high protein milk replacer. 23% calf starter goes along better, and we see better weaning out of that 23% calf starter. Calf needs to be eating about a half a pound per day for 21 to 28 days before weaning. As we move into that weaning stage, what are some different weaning strategies to maintain growth? This is pretty important. Calf starter, calf starter, calf starter. We want to see consumption of calf starter during the weaning phase to be a minimum of 3 pounds of starter for 3 consecutive days before we take milk away. If we take that milk away and they drop off and they start eating less than 3 pounds, we need to prolong the weaning period. Other things about weaning, calves must be healthy. Don't try to wean a calf that has respiratory distress at the time. We need to keep that calf on milk, get it consuming starter and thriving on starter before we start the weaning process. At minimum, a calf needs to be 6 weeks of age or 42 days. That's really a little bit early. Preference would be to wait till a calf's 7 weeks of age to start the weaning process. And again, it needs to be consuming that 3 pounds of calf starter daily. And then when we start discontinuing, we're not going to abruptly stop feeding milk. During that rumination phase, we need the calf to continue to grow. So really the preferred method for weaning is going to be a step down. There's a couple different ways we can do that step down, either once daily feeding or decreasing milk each feeding. And that kind of depends on your operation and how well your calves are taking to their calf starter. Ideally, once daily is going to work just fine. But if we don't have that starter intake, maybe stepping them down to, and if we start at 4 quarts, we're going to step them down to 3 and then 2 during that weaning process to increase that starter intake. If we're feeding that 4 quarts per feeding or 12 quarts per day, we're definitely going to want to step that calf down 6 weeks of age. We're going to cut it back to about 9 quarts per day. And then at 7 weeks of age, we're going to cut it back to 6 quarts per day and work it off of the milk and on to starter. Every time we decrease milk within 2 to 3 days, we should see an increase in starter intake. If that doesn't happen, we need to set that calf back, hold it at the nutritional plane it's at until it catches up and starts eating starter like we need it to. We want to maintain that calf on milk replacer at a decreased rate for a minimum of 7 days prior to complete weaning. We want to manage stress. So if we only do 3 days, that calf's going to be starting up to increase on starter, not kind of hitting that peak that it's going to maintain. And then we're going to try to push it on to even more starter. So by doing a minimum of 7 days, that decreased milk feeding rate, we see much smoother weaning transitions. And then keeping them in the same housing. So if you're in individual housing and you want to move them into group housing, ideally we're going to keep them in that individual housing for another week after weaning to reduce stress. Only trying to do 1 stressful event per week on a calf. And then when we move them into group housing, 2 calves is ideal. We don't want to go over 4 to 6 calves. And really they should be within 1 to 2 weeks of age when we commingle them after that weaning phase. After about a month, we can start mixing calves a little bit larger, age spreads, and that continues as they get older. Some other thoughts, calf hutches versus barn housing. This really is going to play a lot into ventilation and your management of calves. Some nice things about calf hutches is they really allow for isolation of disease. When we're in a calf barn, especially respiratory disease this time of year, if we don't have that good ventilation, every calf's going to experience every pathogen. If we're in a hutch, it's just that calf in that hutch and it doesn't share those pathogens with its neighbors. If we're in a barn setting, we want to have an open front and an open back to allow airflow, but we do want solid dividers between those calves so they're not cross-suckling and touching each other. We want to have good lighting, whether it's in a calf hutch or outside or in a calf barn. We need that good lighting so we can do that respiratory scoring and manure score every day on every calf in our head to make sure they're staying healthy. Looking at ventilation a little bit more, this is one of the biggest challenges we run into is ventilation. It's not maintaining a certain temperature in the barn. What ventilation is the provision of fresh air to a building space. That fresh air is going to dissipate heat, it's going to dissipate moisture, noxious gases, and airborne pathogens. A well-ventilated barn, a well-ventilated calf hutch is about 5,000 to 30,000 colony-forming units in an air sample. Many barns are running over 100,000 colony-forming units, especially in the winter. We button them up too tight. We need this barn to bring air in close to the eaves, and we need a place for that air to vent out up at the top. Just having air inlets isn't going to actually be ventilation. We really need 2 points, a place for air to come in and a place for air to go out. When we look at ventilation, one of the worst things we can have is any sort of ammonia accumulation. Now, we do need to protect calves from any sort of draft directly on that calf. But once we manage to protect them for draft, which is over here at the straight across bars on each one of these. So this is a lung ultrasound study that had been done. And what it was looking at is lung lesions that show that those lungs had been damaged. So the worst thing was a draft on the calf, but the next worst thing is warm, dry, ammoniated air. The warm, dry, ammoniated air saw over 50% of calves had some sort of lung lesions that would be indicative that that calf had bovine respiratory disease at some point. Things that gets better, those normal indoors. We don't want that building to be humid. We look at the larger sizes. We see if there's a lot of humidity building up, we're going to have more lung ulcers. And then that normal indoor climate where we're getting good air exchanges that are recommended, we can maintain a fairly healthy calf. We have to have those air exchanges. So what are those factors that increase bovine respiratory disease? Justin mentioned that smell of ammonia when you walk into the barn. That's absolutely critical. Continuous ammonia levels greater than 4 parts per million has actually been shown to be an increased risk factor for BRD. There's some old work, the recommendation used to say 25 parts per million. Newer work shows that 4 parts per million, utilizing lung ultrasounds, is where those lung lesions begin to develop. The thing is, the human nose detects 5 parts per million. So if you smell ammonia in the barn, we got a ventilation problem that we need to address. We got to get those gases to exchange. We got to get them out of that calf's environment. Relative humidity of 50 to 70%. That's really why winter can actually be a good time to raise calves if we would just have some consistency. Typically, we see lower humidities in the winter. That lower humidity the pathogens don't grow as well. If we're too low, we can have increased dust accumulation. Humidity above 70%, we actually see greater bacterial survival. Anytime we get under 70%, we see lower bacteria survival in the environment. So that 50 to 70 is that real humidity we like. We get drier than that, we can have some issues, but we're really good down to about 40% relative humidity. Relative humidity greater than 85% for 24 hours, especially swings. As we look forward to next weekend, we really have to think how we're going to manage ventilation moving forward when we're swinging from fairly low humidity, cold temperatures to this coming weekend. We're going to warm up into the low 30s. That's, still below that calf's lower critical temperature, but we need to think about opening these barns up so we get really good air exchange, because that's going to actually bring in some more moisture in the air. We're going to have high relative humidity. So we need to move those noxious gases out. We need to move bacteria out of those barns. So we need some good air exchange as soon as it starts to warm up as we go through these different temperature swings. We need to minimize air draft. So in a pre-weaned calf that we're talking about today, our goal in the winter is to be less than a half a mile per hour at that calf's level. Over that, actually creates that draft, which can make the calf sick. So if we have solid walls up to the calf height, then we keep the air moving up above the calf and it's not dipping down. We can keep these calves healthy. Once that animal starts to ruminate, our older calves, about 1 3/4 mile per hour is what starts to create that draft that actually wicks some of the temperature away from the calf. Low air exchanges are a real problem. Non-ruminating calves, we're really looking for about 10 CFM, so cubic feet per minute, or 4 air exchanges in that barn per hour, keeping some ventilation going on. When we get into that older calf, once it starts ruminating, that steer, we're looking for more like 20 cubic feet per minute of air exchange coming in and out of that barn. Things that we need in a good ventilation system and to watch for. We have to have an inlet. We have to have a place for that cold air to come in. It's going to mix with the heat and moisture inside. And then we have to have a way for that warm, moist air to exhaust out. Typically, it wants to rise. We can just use a flat ventilation, but really getting it out the peak is the best way to utilize ventilation. Or if we have a monosloped building, bringing that cold air in low and let it float up and out the barn. Some things to look at: how can we improve pre-wean barn ventilation? So if drafts are created at about 60 feet per minute or 0.68 miles per hour, we can't put a fan on. But what we utilize is positive pressure air ventilation tubes with holes punched to push a really small volume right at that 10 cubic feet per minute per calf into a pen. You can't feel the airflow, but that small amount of air comes in and it pushes the pathogens out. If you're raising a lot of calves, you need to have one of these systems probably professionally designed, because we have to look at where the tube goes, where the calf pen is, and how to get air. When you look at these holes, we need to get air hitting the back of the calf pen and the front of the calf pen so we get a good mixing. Now, if we move into summer, positive pressure air tubes aren't for summer ventilation. They're for winter ventilation. In the summer, we want that to increase to about 100 cubic feet per minute of air exchange in that barn per calf. And that's going to dissipate the heat, going to help remove heat. In the summer, if we want to cool calves, we're looking for about 2.8, 2.5 to 3 miles per hour wind speed to be ideal to cool that calf in the summer from heat stress. And that's when we're over that about 75 degrees Fahrenheit that we might want to look at that for a pre-weaned calf. Positive pressure, we're looking for 10 cubic feet per minute. So most of these systems, we design them at a minimum of 15 feet per minute, but then we make sure some of this air is going to get lost, that right down here in the calf pen, we're hitting that 10 cubic feet per minute per calf. Maximum widths that come out of these tubes, we can cover about 30 feet. Anything over that, That airspeed coming in has to be too fast to travel more than 30 feet, and the tube isn't going to work. And we can reach about 100 feet of length through a calf barn. Any questions across that? I see we got a decent number there in the chat that we can look at answering and talking through.
Yeah, let's start with one for Dr. Kiefer. Tips for tubing. How do we make sure we're got that tube where it needs to be, that milk flowing into the stomach and not the lungs?
You want to make sure the head position of the calf is correct, that that calf's nose is pointing straight out and you're not pulling the head up towards the air or down towards the ground. So you want a level head. You want to introduce that that tube, and has a little ball on the end of it to the back of the throat, and gently push it back down in there. If you're in the trachea, you won't be able to feel it in the calf's neck as you pass the tube, but if it's in the esophagus, which is very soft, you'll feel the ball of the tube pass very freely up and down in that soft esophagus. You'll know you're in there. The trachea is pretty hard. It's got cartilaginous rings in it, so you won't be able to feel the tube as well in the trachea. Also, they'll be coughing a lot more when they're in the trachea. So those are just some tips you can use to tube correctly. And also, there's a ton of YouTube videos you can watch veterinarians and dairy professionals do it as an example.
Both of you talked about calf blankets there for a little bit. There's a question, for this fair season, if there's still value in a calf blanket. I guess initial thought is depends on when your fair falls.
Right. It depends on where your fair falls. If you're going to have a calf under 3 weeks of age between now and April, really mid-April, there's going to be value in buying a calf blanket and utilizing it. As we go through February, we're halfway, a little over halfway through. We're not going to have the really cold nights, but when we think about any time that we'd be freezing water outside, that's really going to take us till about mid-April. So if we're going to have calves under 3 weeks of age, I would encourage those calf blankets. And it's that one-time investment. If you're going to be buying calves again in the future, once you have it, you'll be able to use it from year to year. The biggest thing, I guess, on calf blankets is make sure you buy the right size for the calf you're going to be purchasing. If you're going to be purchasing a Holstein or a Holstein beef cross calf, you're going to need a large blanket. If you're purchasing a Holstein Jersey cross or a Jersey Angus cross, those are going to be the small and medium blankets for those calves.
For wean calves, free choice to the outdoors, is it necessary?
Is it necessary? I guess it's not necessary, but it doesn't hurt if your production system allows for that. Those wean calves, they're thermal neutral down to 32 degrees. And as they start to eat more hay, they can handle those cold temperatures. If they're cold, they're going to go inside. So it doesn't hurt anything, but it's not a necessary requirement to provide them an outside run. The necessary requirement is to provide them good indoor air.
A question about ramping calves up on milk. Starting at 2 quarts of feeding. Then how often do we increase to 3 or 4 quarts?
Yeah, so you don't really want to go over 4 quarts per feeding. Prefer more feedings at that 3-quart amount. So when you look at ramping calves up, day 1 to day 2 or 3, 2 quarts of milk, or all they want to eat at that 3-quart. Don't try to push it on them. If you want to start feeding 3-quart at day 1, really day 1's colostrum, so say day 2, you can start feeding that 3-quart twice a day. By 5 days to a week of age, offering them that 3-quart. By 2 weeks of age, on to 4-quart of milk per feeding. And then if you have that ability to feed multiple times a day, 3-quart 3 times a day is going to be better than 4-quart twice a day as the calves continue to ramp up and grow. And then at 6 weeks of age, once they've started to consume that starter and starting to become a ruminant calf, we're basically going to start working them backwards the same way we worked them onto the high plane of nutrition. At 6 weeks of age, if you're feeding over 3 quarts per twice a day to a calf, so over 6 quarts total, we can start backing them back down as they increase in that starter intake, getting them down to about 3 quarts per day for that 7th week as we work them onto full starter. And then by 8 weeks of age, they should be consuming enough starter to take off and grow. You just kind of have to learn your calves. And that's one of the challenges buying calves from a stockyard. You're bringing in some different genetics versus a single source dairy operation may wean a little bit different, take off on starter a little bit different. And you're going to have those calves that had either scours issues or respiratory issues that are going to get set back a week. And you're going to be weaning them more like 8-9 weeks of age, doing that cut back to 3 quarts per day on that lower feeding plane.
The max milk, as far as quarts per day, we talking 12?
Yeah, max milk is in quarts per day. It's really whatever that calf will drink if you want to offer it free choice. But on average, that's 12 quarts per day on the free choice feeding systems that we find a calf will typically eat. So there's no amount that's too much, as long as you're splitting it up into multiple meals. Where you can feed too much is in one meal. We can feed too much, but if we're feeding these calves 4 times a day, we can start to offer them as much as they want to eat in each one of those feedings, and they'll grow. And then it's just working them back off of that milk through the weaning phase.
Looks like this may be better suited for Dr. Kiefer. Any standard recommendation as we transition these calves from either the dairy or the sale barn to home to reduce diarrhea potential? Do we give everybody an antibiotic, some sort of prophylactic probiotic paste? Any suggestions there?
No, I don't really recommend giving mass treatment of antibiotics unless they're really super high risk calves. So not a great use of an antibiotic. I think getting them home, depending on how long you're trucking them, if they're going many hours, which probably is not most of the people on this call, you may want to think about an electrolyte, drench when they get home. But if you're just going less than an hour or two home, they aren't going to need that. They're just going to go home, need to get home, get a clean, dry bedding, and feeding of milk. I think when they get home is pretty important there.
And then another animal health question just come in. Recommended age for castration and dehorning. Do we want to do this when the calf's still on milk or after weaning?
I want to do it as soon as I can, even if the calf's wet, to be honest with you. I mean, I'm serious. Like for castration, if you can pull those 2 little testicles down when they're a few days old and put a green band on them, great. The sooner you castrate them when they're smaller, the way easier process it is to get them through that painful process than castrating them when they're 3, 4, 5, 600 pounds. So the same is true for dehorning. When they're small and they got the little horn buds, you can put either dehorning paste on them or you can burn them off. Scooping them later leads to larger wounds. It just takes so much longer to healing. So in that first week, you can do both of those things really easily with minimal impact on the calf.
Jason, just real quick, question about bottle height. Want to reiterate the reasons why we don't put that bottle too high.
Yeah, so when we put that bottle too high, we can really get 2 things that are going on. One is when it's too high, they'll actually suck air down into their stomach, and we don't want that. But also when it's too high, the esophageal groove, we don't get the flapper to work quite properly that protects milk from getting into the lungs. If you're feeding a calf milk and it starts coughing, we got some issues there. Potentially the bottle's too high, or we have some respiratory problems in that calf to be concerned about. Or if it aspirates milk. So you feed it milk and then you see milk come blowing out its nose when it gets done. We aspirated some milk potentially into the lungs. So we need to look at that feeding height and getting that S shape so our esophageal groove works properly to put that milk into the abomasum.
There's a question about brands of milk replacers. And I think we kind of touched on this. Brand and price probably not as critical as nutrient value.
Yeah, brand and price, I wouldn't recommend one brand over another. It's really more what that nutrient content is that you're looking for. Looking for a higher plane of nutrition than a 20/20 on that fat and protein content. And then do you want a coccidiosis, a lacillacid medication in there? And then the other consideration is most of your high plane of nutrition products utilize a milk protein, but making sure that it's derived from milk proteins and not soy proteins.
Then kind of last question has to do with beef on dairy. The question was, what's the best breed? I guess I've got some thoughts there. Jason, do you have anything?
Yeah. Thoughts on that really comes down to, as much as breed, looking at what we need. We need to create a calf that fits into our production system. So we want to look for that calf that has good rate of gain. We get pretty good marbling coming out of the Holstein breed. We might want to have a little bit smaller, more consistent loin eye. The Angus breed works well. We see some limb flexes, some scimitals going in. And also, are you selling it into the feedlot, or are you retaining that calf and feeding it out yourself? We've seen some really good Hereford Holstein crosses come through, but they just don't fit the production system generally for a normal feedlot, or it's not what the packer's looking for. So you have to consider that when you're selecting the semen, really going back to the dairy side. A lot of the beef on dairy genetics is being driven by Western feedlots and their feedback coming back into our AI studs.
Yeah, I mean, there's probably bigger differences, but within some of the breeds, there's good sires that can be mated to Holstein and Jersey cows, and there's some that probably shouldn't be. Anything that we can moderate frame in a Holstein, add some ribeye shape, add some performance is probably what we're looking at.